Hello people, in this video let us look at how to read surgery in MBBS. So surgery is a subject that is having total theory marks can be around 200, which will include orthopedics. Okay, it will be a separate question paper and separate answer paper usually for orthopedics. Remaining surgery you will have to write. Okay. So there is nothing like radiology, anesthesia, etc. There's no separate chapters or questions from these. This is all blended in very much. Okay. Now coming to practicals. Practicals you will have long case. Usually it can be a thyroid case like a multinodular goiter, a carcinoma breast can be there, hernia, inguinal hernia mostly, varicose veins they can give. Short cases will be usually hydrocele, lipoma, sebaceous cyst, ulcer, etc. Remember, sebaceous cyst will have that punctum and it will also, the skin will not be pinchable, right? These are some features you should know. Ulcer can be a diabetic ulcer, it can be a venous ulcer, it can be a CVA, right? Peripheral vascular disease, okay, it can be that. Then coming to orthopedics, you usually will have malunion. Malunion is so common, okay? People don't, they fracture, they don't go to the doctor. They'll go to some quack who would have done some oiling massage and fixed it, and they wouldn't have reduced the fracture. So they will go into malunion. So in orthopedics, you will, these are the type of patients you will get in your practical, malunion, okay? And osteoarthritis, very common you will get, okay? Most common, these are the cases you will get. So basically, the thing with this is you have to give 5 cases. Yes, 5. Okay, usually this is how it is. Usually, approximately, we are telling you. Viva, you will have instruments like same instruments. All your variety of scissors. You will have Mayo scissor, etc. Then coming to X-rays, you will have variety of X-rays of surgery X-rays. What will you get? Any obstruction, intestinal obstruction. Is it a large intestine obstruction? Is it a small intestine obstruction? Are you paying attention, people? What are we talking about? Viva. Drugs, what drugs will they show you? Usually drugs, drugs I'm trying to recollect. Did we have drugs at all? Procedures, you should know how to do thyroidectomy. You should know, you'll open the platysma muscle, all the muscle names you should know, which layer by layer, whether the incision is transverse, whether the incision is vertical incision, all that you should know, okay? Then procedures you should know about Hilton's, that incision drainage, all that you should know. Then what else, people? Procedures means you should know all the procedures, okay? You'll have to say the steps, okay? Coming to the textbooks that you will refer to for surgery, I referred Manipal Manual of Surgery, and along with this you use the question bank from your university, whatever question bank you have. Look at the priority questions which have been asked more than some 2-3 times. That is only what you have to read, okay? Other than this, people also use SRB Manual of Surgery textbook, and the lecturers always talk about Bailey and Love. Okay, so it depends on what you want to use. I used Manipal Manual of Surgery. It's up to you. Okay. Coming to practical and Viva book, the lecturers will tell you to use Das, clinical manual on clinical surgery. Das. This was very good in describing a swelling, describing an ulcer. What are the features of an ulcer? What are the adjectives you'll use for an ulcer? It is a rolled margin, or the kind of adjectives you can write nicely. But the actual book that you should buy for yourself is this Raja Mahendran. Or some people buy this one also. But Makhanlal. But anyways, this book, you know, in this there is one more short cases book also. Buy both, okay? Raja Mahendran, long cases and short cases. What happens with these kind of books? Are you paying attention, people? With these kind of books, you don't get half the picture. Like Das will give you half the picture. Das will tell you what? He will tell you ulcer is there. How will you describe the ulcer? Margin, depth, base, rolled, etc. All that he'll tell you. But he'll also tell you how to find out whether it is a venous or a arterial ulcer, etc. Then it will go to what are the causes of varicose veins, what are the surgeries you will do, what are the complications of the surgery. This information, the further information is not there. The causes also is not there in Das. Das will give you an incomplete picture. So if you want the complete picture of any case in one book, then you have to buy these clinical books which will help you. See, how to check, you know, all that Trendelberg test for varicose veins, or so many tests are there, right? That and all you can learn from Das, but Das will not give you the complete picture. Okay, that is what is we are trying to say. So you'll have to buy all books like this. Okay. Now let us go further. Listen in class, attend the OTs, listen in your practical classes and your theory classes, especially your practical classes. If you listen, it will be very good. They will be telling you what they do daily, right? And they will tell you the important things. They will tell you in a crazy way that this is what it is, and that will register in your mind. Then important things also they'll be telling you. So you please listen in class. So how's it going so far, people? Now let's get to the depth of surgery, how to pass, how to read. These are the top priority questions that will come for you. I just remembered, guys, actually what they keep in your Viva is also pathology specimens, like a gallbladder they can keep, or they can keep thyroid gland. Okay. See, like this they have kept, see, gallstones. They'll keep the gallstones. They'll ask you to explain everything about gallstones. Okay. These are the top priority questions in surgery, guys, that you should know to pass. So each of this we will look at in detail. Just look at the headings now. Gallstones, cholate, lithiasis, you should know. Volvulus of sigmoid colon, omega sign, all that you should know. Mass and right iliac fossa can be ileocecal tuberculosis, appendicitis, etc. You should know this. Renal calculi, you should know the types of renal calculi. Can be your calcium oxalate, it can be uric acid, it can be struve stones, cystine stones. Benign prostatic hyperplasia, you should know TURP, that is a surgery. Then varicose veins, you should know all those tests that you do, right? Then the operation that you do, Trendelenburg operation. Melanoma, very important to know how you'll treat. Wide excision, hernia, inguinal hernia, etc. Femoral hernia, how will you differentiate? A lot of videos we have separately on this. Pancreatitis, alcohol can be a cause. Then it can lead to pseudocysts. So many stomies are there, cystogastrostomy, all those surgeries you'll have to know. Anal fistula, so many types based on the sphincter, whether it is between the internal and external sphincter. Then Goodsall's rule comes in this. Achleia cardia, basically the lower esophageal sphincter is kind of, it's not relaxing, so it's constricted. What can you say? So the food doesn't enter the stomach. There'll be a lot of reflux, right? Stomach cancer, you should know about the surgeries that you will do. Appendicitis, you should know about so many signs, roving sign, shifting pain sign. Varicocele, why is it more on the left side? Because of the anatomy of the varicocele. Basal cell carcinoma, you should know rodent ulcer, that is rolled up margin. Dermoid cyst is benign cystic teratoma. It's a teratoma, it will have teeth, hair, etc. It can be in ovary. Crohn's versus ulcerative colitis, how will you treat? In ulcerative colitis, you can do surgery, and because it's a continuous, and then you can also give 5-ASA, that is aminosalicylate acid. But in Crohn's, you cannot give both of this. Basically, for both of these conditions, you can give glucocorticoids, that is steroids, right? Then you can give azathioprine, methotrexate, etc. So, intestinal obstruction, you should know that there are so many types of obstruction. It could be in the lumen, it could be in the wall, it can be outside, and it can also be dynamic or adynamic, that is neurogenic. So, you should know about paralytic ileus, Hirschsprung disease, all that you should know, okay? So, these are the top priority questions. We will again come back and look at all this very much in detail, okay? People, just look at this list, okay? In this list, you will not get clue whether it is from intestine or from stomach or from thyroid or what. So, these are some things that you should know. Where do you get Sister Joseph nodules? Where do you get Ladd band? So, this you should know. These questions don't give you a clue as to which organ it is from. So, better to know these terms, okay? So what is Burgess disease, guys? Something to cause your peripheral vascular disease, thromboangiitis obliterans. Charcot triad, you have seen in gallbladder, cholangitis, right? Then Marjolin ulcer, something to do with burns, etc., the scar. Then Courvoisier's law, gallbladder. If you can feel a gallbladder and there is jaundice in this person, most probable cause is not gallstones, okay? Goodsall's rule you have seen where in fistula. Fistula, basically they're telling you, if it is posterior, it will not be going directly. It will go here and there. Okay, that is what they are saying in Goodsall rule. Then carbuncle means what? In diabetes, those multiple, pus-filled cluster of boils. Basically in diabetic people, this will be there. Okay, so this they have treated and they have removed all the pus. What is epulis? Remember, okay, painless swelling upon the gum. Okay, remember epulis. Please write. Epulis means gums. Okay, you remember it as gums. Okay, gums means where will be in the mouth. Yeah. Bailiff's hernia means what? The W. In Google, if you search mailed hernia, maidal hernia, you will get our video only. See this W, and the you can see the strangulated part is there inside. Okay, WW. Okay, remember. Then phymosis, something to do with the penis, isn't it? You remember that very well. So foreskin is so tight you cannot retract it. So basically here, this is the only actual indication for circumcision. Then Shataki's ring. What is this like? Sounds like Pataki ring. See, there's a stricture here, esophageal stricture, Shataki's ring. Okay, if you can remember this is something to do with esophagus. This is something, just remember here, next to each of this you write off one word, okay. Sister Joseph nodules, just now you saw. Where did you see? Some umbilicus, yes, stomach carcinoma, very good. Lad band also is GI, basically this below the stomach. You can see here, duodenum, lad band. So basically what is this causing? Intestinal obstruction, lad band. I think this Monders we missed. Monders, let's do it. Monders, basically thrombophlebitis, superficial veins of breast, anterior chest wall, okay. Then coming down here, Mercedes-Benz sign, we already told you, gallstones, erysipelas. Infection of the upper layers of the skin is superficial, is caused by streptococcal bacteria. Millian's ear positive sign. So something to do with the skin, this one. Now let's come to cafe au lait spots. This you will see in what? Neurofibromatosis, neurocutaneous disorder. Focus here people, these are the neurocutaneous marker. Cafe au lait spots, neurofibromatosis. Last one guys, very good. Oshner, Sharon regimen, appendicitis, Nilpar oral antibiotics. So these are the specific terms you should know. Now let's move on guys to the next slide here. What exactly, how to pass surgery, how to study surgery. Common terms you should know. Tomy means more like a cut or a hole. Ectomy means you are removing something. It could be a partial or a total, you are removing it. Radical means all lymph nodes, etc., etc. So this can be so many: thyroidectomy, pancreatectomy, cholecystectomy, so many ectomies, right? Then coming to endoscopic surgery, nowadays latest everything is like this. You don't make incisions, you go via the endoscope and do the surgery. You do via laparoscope, you make the surgery, and ultrasounded guided. All this you will write in the exam, okay? Then your surgery paper, you should spray it with lot of words like what is pre-anesthetically, what evaluation you will do, prepare the person for the surgery, you will do chest x-ray so that you can find out what anesthesia can he take, prophylactic antibiotics, you will paint the place with iodine, that is povidone, iodine, betadine. Aseptic environment you will maintain, otherwise what will happen? There can be infection. Always complications you will write. Early complication means hemorrhage. Late complication you can write infection. Standard things, okay. What will you see in intermediate? Intermediate, usually you will see complications of nerve damage, okay. Any nerve damage if it has happened, etc. Then you can learn what is primary hemorrhage, secondary hemorrhage, reactionary hemorrhage. All those terminologies you should know, okay. Now coming to diagrams. So draw diagrams in your exam. So if you draw something about inguinal hernia, you want to write, draw this inguinal command, draw this abdomen, draw those quadrants. Something you draw, okay. It will keep the person who's correcting your paper to be interested in correcting. Orthopedics will cover in separate video, okay. So basically surgery you have looked at. So the top priority questions are there, no. This one, top priority questions, each of this we will revise now, okay.